To discuss this further and look at the implications this has, I'm now joined by Dr. Adrienne Wulfsohn from the Progressive Health Forum. Dr. Wulfsohn, good afternoon. Welcome to today. Thank you for joining us here on eNCA this afternoon. What is the impact, of the shortage, this big shortage of ambulances in different parts of the country? Every province is facing different challenges in terms of numbers, but the government says there that it's largely due to routine maintenance and repairs. What is the real impact on the ground?
The impact on the ground is we don't have ambulances, and this is not a new thing. This has been going on for the past 25 years. What we do is we unfortunately do not budget. When I say do, I don't mean me, but from a national point of view, we need to hold accountable the people that sort out the budgets for each division, and we need to budget every year to at the moment we're going to have to upgrade up every time because we've lost many years of ordering ambulances by lack of budgeting, lack of ordering. The other thing is ambulances are not your normal vehicle. They obviously are built on top of a specific chassis. So they are involved in motor vehicle accidents. There needs to be proper due diligence and proper quality management and maintenance of these vehicles. At the moment, there is one major company looking after and maintaining all the government vehicles in this country. Now, that's not one ambulance will go in, but another vehicle will go in, which is not an emergency medical service ambulance. So you now have delays within the actual maintaining of the vehicle because you've got other vehicles that they're fixing. So there's a delay in maintaining the vehicles. There's a delay in replacing new ambulances after they've been written off. Ambulances shouldn't do more than 200,000 kilometers, which means they do get to their write-off stage fairly early. This is not being managed by the powers that be and the people that need to be accountable for management of ambulances within all the 9 provinces of this country. It is not just one province, it's every province that faces this.
Yeah, and the numbers are not looking good. I was looking at a report the other day in the media about what the response from Dr. Phaahla in Parliament was in terms of the numbers. So it sounds like it's a layered problem. We got different layers to this problem, as you've just explained. Things like budget, things like lack of planning and lack of maintenance. And you said it's been going on for 25 years. So buying a new fleet of ambulances isn't going to solve the problem.
Well, if they're telling me that there are 200 vehicles in the Northern Cape, then I have a problem because we need at least 500 or 600 vehicles, and I'm not quite sure if we're going to be able to afford that kind of money at once off. So it needs to be staged. The other problem is, besides the shortage of vehicles, we have a shortage of operational staff. And we can blame the skills drain and people leaving. However, in the past few years, there's been a total change in education of the pre-hospital personnel. So your paramedics are now becoming degreed personnel. So they start off at a university and finish at a university and are then put in a response car. Have not been operational other than training. So we've now got a short gap. When we started this quite a few years ago, there were no people being trained in short courses. So authorities like SAQA, Amalusi, HPCSA, I don't know if there's just been a lack of communication, but what they have created by creating this kind of higher training, which I think is remarkable. It has given our paramedics a pathway, but what it has done has decreased our active basic life support staff in the ambulance and that can do basic planned patient transport. So if you have fallen and hurt your finger or your toe, that's the basic ambulance we need, not somebody with a degree to come and pick you up. And I think because of this, we now have a relative shortfall of personnel. So if you don't have sufficient vehicles and you don't have sufficient personnel, appropriate personnel, you cannot run ambulance services.
Yeah, thank you very much for your time this afternoon. That's Dr. Adrienne Wulfsohn, just unpacking the ambulance crisis in the country, the shortage of ambulances. Government is saying there's challenges with maintenance and repairs, budget issues, but Dr. Wulfsohn says this problem has been going on for 25 years. And people, especially in rural areas, who rely on public health services are really, really suffering due to the lack of these ambulances.